After a TBI, many of our patients have a common goal: get back to work. As speech therapy professionals, we have much to offer to help our patients get there. One incredibly useful task is to work on metacognition, or self-awareness. Self-awareness in terms of TBI is the extent to which a person is aware of their current abilities, including cognitive strengths and weaknesses. And many of our patients who've experienced TBIs have at least some difficulty with metacognition, usually showing up as difficulty predicting when they need extra support to complete a task accurately. For example, feeling like they can manage their schedule because they were able to do it before the TBI, but having difficulty with organizing and planning. So it's hard for them. What can we speech therapy professionals do to help with self-awareness? A lot, actually. Here are the steps to metacognition treatment. Number 1, set up the task and describe the purpose of it. Taking the scheduling example, you can say, let's work on making your weekly schedule. That means making decisions and taking actions to make sure you have time to do everything you hope to do this week. Right now, let's work on placing your appointments on your calendar. Number 2, ask them to predict how they'll do on the task. This takes self-awareness because they have to think about the skills and abilities that are needed for the task, then reflect on their own skills and abilities. For the scheduling example, you can say, it looks like you have about 6 appointments this week to place on your calendar. Predict how you'll do on the task. Try to pick a task you believe that they'll have a fighting chance of completing. If you believe they could benefit from more support, you could download the game plan worksheet at adultspeechtherapy.co. It's a template your patient can use that helps break down this task into steps and then helps them identify potential barriers and support. Going back to metacognition, step 3, after the task, ask them about their performance. Were they successful? Accurate? You could simply say, the goal was to place 6 appointments on your calendar. How did you do? And step 4, compare. Ask them how their prediction compared with their performance. This is typically a discussion. You could ask what went well, what's missing, to start that discussion. To take metacognition training to the next level, you can then discuss what they can do differently next time to increase their performance. For example, let's say your patient repeatedly went back to the same appointment. You can train them to cross off each appointment from a list so the task goes more smoothly next time. Check out adultspeechtherapy.co for more treatment ideas for getting back to work after a TBI, including social communication tips, stress management tips, and links to that free game plan worksheet.